Uh, Thank you, everybody, and thank you all for all of you who have come out in person. Because can say certainly over the COVID period, to be talking to people virtually through bubbles and screens, it's just not the same. So to be able to see you all, shake your hands, actually meet you personally, again, it's really an honor and a privilege, and thank you for that. I've been given the task to talk about the where are we going in terms of family practice. And so again, as you know, I've got a very different view to words like the plight of the GP, or if anything, family practice is the bedrock of healthcare. General practice, family practice, and hopefully as I move through my presentation, you will hopefully get a sense of just how important your role is. And there's this need, and we are very strongly agree with Dr. Naidu, for the evolution of family practice to be able to take advantage of the change. I work for an organization that theoretically shouldn't be where it is today. When Discovery Health started, it was very close to the 1994 elections, and nobody gave Discovery Health and Adrian Gore a moment's support to say that this organization will grow to what it is today. Adrian has a view that within diversity there's opportunity, and hopefully as we talk to there's lots of issues, and we don't look at the world through rose-colored spectacles. There's problems, but how one actually faces those problems and addresses those problems will be a testament to your success. So as we move forward, and hopefully my presentation moves forward, it's another little problem. There we go. We'll talk a little bit about global and industry trends. We'll look at our local environment, and then we'll specifically spend a bit of time on the way forward. Because as again very eloquently says, in order to succeed in this environment, you can't act like you did before. The world has changed, and quite dramatically so. So what are those changes? And perhaps we'll make some suggestions about how you can potentially address your practice and see how you can actually take advantage positively of the changes that exist out there. So a couple of issues really need to be considered here. Hold on a moment. There we go. So one is the healthcare system has been restructured. The pace at which that happened, but in the COVID environment, is sublime. Nobody expected a pandemic, and nobody expected the change that that pandemic drove. We'll talk a little bit about that. Healthcare utilization dropped dramatically. You all felt it during the COVID period. It's back. Okay, people need healthcare. We'll talk a bit more about that, but it's a little bit different. Okay, and if you're focusing your practice on helping people solve those problems, okay, there's no doubt that your practice can be successful. Place and service and care, it's different. We're in a digital age. We're on a hybrid course today. Patients like hybrid. The reason why you should consider digital is because patient wants it, not because Discovery said so, not because Sugen said so. It's because that's what your patients are asking for, and increasingly that's how the world is playing out. Mental health care, we'll talk a little bit about that. It's the new pandemic. Okay, and we'll talk more about that. And then value-based care. What does that mean? What is value-based care? You've heard that term many, many times in the discourse around healthcare and care delivery. What does it mean, and how could you play a role in that? So moving forwards, if you start to think about alternative, well, not so much alternative reimbursement, but care delivery, there's no doubt that there's been a radical digitization of the whole world. Okay, and healthcare is not immune. If you look at American Medical Association 2021, 85% of doctors using some form of telehealth, patients accessing care at home. Okay, and I've met doctors engaging with healthcare professionals around the world who have some of their patients they've never seen physically, which is a big mind shift, I think, for many South African doctors. But there are ways to do that safely. In some instances, I don't think South Africa is yet ready for a complete telehealth solution, nor do I think our Health Professions Council regulations make absolute provision for that. I mean, you need quite a strong relationship in the South African environment to continue with an electronic type of relationship with the patient. But the patients want it, and the practices that provide it are going to see more of the patients. So we're going to continue to provide access for you to virtual consultations and a whole range of different tools in telemedicine. Okay, and they're all at no cost to you. They're on today. They're on the Discovery Health ID platform, and with the support of EMC and some of the people that you engage with, we've run various webinars. Some of my colleagues at the back have been available and have run sessions for you and your groups. Okay, it's all available to you now. There's no additional investment required. There's a mechanism for you to engage with the members of all the medical schemes that we administer on a digital platform. And my suggestion to you is try it. Okay, see how it works for you. Okay, because I'm telling you, the patients want it now. How does how do you actually build it into your delivery option, your care delivery options? This for me was a very, very surprising study. This is JAMA, Journal of American Medical Association. Because if you think about it, there's that sense that we always need the human element, that the human element in many instances is preferable to the digital element, because the digital element is cold, that you can't necessarily get a sense of feeling through the digital element. Well, what happened here is artificial chatbots engaged with various cohorts of patients, as well as a cohort of in-person doctors. And it was interesting that quality, 79% of quality scores were good and very good for the chatbot versus 22% for the doctors. Okay, but this is the one that blew my mind. 45% of empathy scores, okay, this for the chatbot versus the doctor. And if you think about it, that's not that unrealistic. If you think about it, at the end of your day, how exhausted are you? Emotionally drained after carrying these heavy burdens of people coming to you with problems all day, helping them solve issues. The chatbot doesn't get tired. Okay, it's electronic. So the sense and feeling, the tone of the voice of the chatbot remains the same. The doctor's human, the doctor gets tired. Okay, so what I'm saying is the world's changing. And what you're going to keep on hearing about telemedicine is that it's not going to replace doctors. Okay, that's clear. You hear this over and over again. But what they keep on saying in every conference that I've been to globally and locally is that the practices that don't adopt elements of digital medicine are going to replace the practices that do. Okay, so you have to start to think about which pieces of digital, okay, might be useful for your practice. It doesn't mean that you have to remake your practice on Monday morning. Okay, it's a slow and deliberate process, picking out pieces and trying the pieces that make sense for your practice, your context, your patient base. Okay, and taking advantage of some of these tools. Moving into utilization, as again mentioned this, there's, and in some instances, this is a very positive story for family practice. Okay, what environment has got unmitigated demand? Okay, if you're a car manufacturer or, you make widgets, they have to create demand. If you're a family doctor, people unfortunately will always get sick. It's a biological certainty. You're always going to have patients. Okay, the problem is how we manage them makes a difference. And what's happening over time is with the advent of very expensive technology, the costs of caring for people keep on growing. So we've got a lot of pressure and issue here. And here's just an example of oncology. And it's especially in people who can't afford it, creates a bit of a financial toxicity. And the financial toxicity is people trying to afford ultra high cost medications. Like there's courses, you'll be well aware, courses of oncology, sometimes like 60 to 80,000 Rand a dose. And sometimes you've got 6-week courses. Okay, so if it's your family, if it's your patients, you want them, right? You want, there's new, and there used to be a very small layer of ultra high cost drugs. There's now many. So it's not the doctor's fault that there's a problem with healthcare. There's a problem with healthcare affordability. It's a growth in technology, and this has been, the way it's gone for tens and tens of years. However, we all have to get together to solve the problem because we want to help people access these new technologies in the best way we can. However, we can't get to a world of financial toxicity where people just can't afford it, or they're selling their house, their car, and destroying other elements of their life to be able to, extend life. So we've got to work together to do this. We've got to remake healthcare, especially for the family practitioner. the pandemic post-COVID is a reversion to the pandemics or the diseases of lifestyle. Mental health, well, that's not a disease of lifestyle, but mental health is often an underpin or a consequence. Diabetes, oncology, cardiac disease, all these diseases, prevalence keeps on rising. What's also important to know is that certainly in the private healthcare sector, it hasn't grown, largely because of economic constraints. So what you've got is an ever-aging, ever-sicker population in the same bubble. And that obviously with a growing disease burden creates further problems. So there are these challenges, okay, that we can't ignore, but there's things that we can do about them. How do we start to solve some of these problems? Well, we can't do what we did yesterday if the problems of today are different to the problems of tomorrow, of yesterday, I mean. So if you think about it, pre-COVID hospitals, it was very centralized. You think about it, pathology was done in a pathology lab. What happened during COVID? You could drive through, get your PAT test. Home testing, okay. Massive opportunity through discovery, through various other vendors to be able to do pathology in your rooms. The patients love it because they don't have to go somewhere else. The cost of tests are often lower. It's actually more cost effective and it's better healthcare. It's a lot before they leave your rooms. Okay, but we've got to do it differently. Okay, if you haven't thought about point of care pathology in your rooms, chat to our team. Okay, in addition, it's a revenue center for your practice. Got to think about these things. Consultations previously always in person, increasingly virtual consults. But if you look at that last panel, virtual consultation with examination. Okay, that's a TATO device. The patient can have this. This is available today. This isn't science fiction. Okay, you can do an examination of the patient if they've got that device at home. You can look in their ears. You can listen to their chest. Okay. Also, all of those devices are artificially supported. Okay, with artificial intelligence, and you'll get decision support built into the tool to help you actually pick up breath sounds. Look at the ear. It will give you suggestions as well, and it will help you pick up problems. So lots and lots of opportunity. Here you've got a sense, mental health, I've mentioned, massive problem. Okay, you can see depression. And I mean, not surprising. If you think about the economic pressures, load shedding doesn't help. I mean, sitting in the dark doesn't exactly improve your mood. Healthcare, the economic pressures, both of COVID and then of current geopolitical stresses and strains. The oil price, your petrol costs and so on, all of these things create great pressure. So it all contributes, as you know, to depression, okay, mental health care, illness. We know that people are less compliant if you're depressed. Very clever doctor that I once, that I met at one stage called depression, sadness with inactivity. And that's one of the problems with depression. Just how do you get, there is help. How do you get that patient to actually almost take the help? It's really frustrating. So there are lots of tools, and look out for them. I'll talk to them in a bit later. But not only have we got certainly quite a big cohort of healthcare professionals in this country, we've now got the support of digital tools. In addition to that you can add to your practice, okay, that can support patients who have got mental health care problems, especially if for whatever reason you can't get them access to a mental health care practitioner immediately. We speak of change, and Stigen spoke about it a little bit in his opening as well, that funding for healthcare needs to change as well. But there's a bit of a problem with fee-for-service reimbursement. And what is that problem? Fee-for-service reimbursement reimburses activity. You get paid for what you do. Okay, but this in many ways is a little bit backwards, because if somebody gets sick and you make them better, they don't need your help and they don't come see you. Whereas if somebody doesn't get better, they come see you more often. How are doctors paid under fee-for-service? You get paid for every time somebody comes to see you. You don't get paid for keeping them well. You get paid when they get sick. Is that a little bit backwards? Shouldn't you rather get paid to keep them well and to avoid them coming to see you? If you think about it in specialist care, you get paid much more if the patient goes to ICU. So if the patient comes into a general ward, deteriorates, gets sicker, okay, they've got to ask you, the doctor gets paid much more. And not even a little bit, much more. Okay, wouldn't the incentives be different if we actually got paid to get them out of ICU? Okay, and that's what you're starting to see with this movement to bundle payments and alternative reimbursement. Okay, is this attempt to actually realign incentives to actually reward better health. Okay, so rather looking at a population health model where you've got a population, and if that population stays healthy, you get more. And we'll talk a little bit about that because those models are out there and available for you today. I'm pleased to say that Discovery Health, amongst others, okay, is very involved in this type of funding innovation. This is a World Economic Forum article where Discovery was showcased. Many of you are actually participating in some of our population models. Okay, and we are in this discourse globally to help the evolution of global healthcare innovation. And it's very exciting to actually watch how those doctors that are partnering with Discovery Health are also part of this process. So again, we really welcome you into joining these programs and processes, and we'll keep on communicating with you and keeping you at the cutting edge of healthcare delivery globally. Talking a little bit about our global environment, and again, that's why I sometimes get a little bit despondent when you hear, the medical profession talking about how things are deteriorating. They're not. They just aren't. If anything, South Africa is absolutely at the cutting edge of healthcare. I mean, these are people we know well. They're on TV often. Glenda Gray, at the height of COVID, had a phone call to Anthony Fauci, the American advisor to the president on COVID, every Saturday morning. Glenda Gray was leading the global COVID response. Slim Karim, these are people absolutely well, that are leaders, absolute leaders. Okay, South Africans who, we should have great pride in terms, and this isn't the only walk of life. Okay, I had the privilege yesterday of, I was at Stellenbosch at the Tygerberg campus, and I was in there. I don't know if you've been there. You have to go if you've never seen it. Their skills lab. The skills lab at that Stellenbosch campus is absolutely cutting edge, mind blowing. Okay, there is no international person who won't walk into that campus and be absolutely blown away and excited about the quality of doctors that are built, created in this context. It's not deteriorating, it's getting better. Okay, and you just have to open your eyes and see it. It's very, very exciting. Industry-wide global transformation, you absolutely, I mean, we've got broadband connectivity, we can talk to anybody, we've got industry-wide collaboration. Yes, there are some people who keep on trying to pull us apart. It doesn't have to be that way. Okay, I don't know any doctor who isn't willing to give up their time and effort in support of patient care. I talk to doctors all the time. Everybody's willing. It's a sense of collaboration and cooperation, and we can solve these problems. Very exciting is the change in the regulatory framework. Again, we just have to open our minds to this and actually see. So if you think about the health market inquiry, which everybody said was going to point fingers at different people and show people that there were problems, it didn't. It actually opened up a whole new discourse in terms of how we can deliver care. And it specifically shone a spotlight on focusing away from fee-for-service and opening up everybody's eyes to alternative reimbursement population models, capitation reimbursement and funding, and reimbursement for keeping patients well, rather than just paying when people get sick. The other scenario, and I know, again, and I talk about this often, is that there are draft regulations at the Health Professions Council about how teams can come together to deliver care. Healthcare is a team sport. We're not about individuals. You need to work with specialists, allied therapeutic professionals, surgeons, various parties to be able to deliver care. So there are draft regulations. One hopes that they are ratified shortly. But we are going to get to a place where we are absolutely unlocked to be able to work within a multidisciplinary team to treat patients. The question, though, is have you got a team? In your practice, are you working individually as a family doctor, or how connected are you with your team? How often do you talk to a team? Is that team formal, informal? How do you actually engage with healthcare? And I'm going to just encourage you just to start thinking about those issues. I'm going to move a little bit quicker. Not sure how much time I've got left. So again, maybe you can give me an indicator. You're still okay. Just warn me, please. Good stuff. So a range of different issues. We're going around the country Important that we hear doctors so that we create products that make sense in the South African context. So we are now almost, I think it's our third round now, to my colleagues of just going around. We literally go to every city. There's cohorts of doctors that we just meet with personally. We try to listen to understand what the context is. We have these round tables, as you can see, and we're starting to lift out what are the current issues in the South African context that we should potentially, as a funder, in collaboration with the profession, be focusing on. So there's 7 ideas that keep on repeating themselves in these contexts, and then I'll show you how we've tried to bring those to life. So firstly, data and digitalization. We've spoken about that. I won't speak much more about it now. So again, I'll tell you, I could speak all day on this. I actually get quite excited. Future focused practice models. It needs to be different. Okay, if you're working just as a solus practice in a discipline, there needs to be a team sport. You need to create a team. Now, the team doesn't necessarily mean that you have to employ a cohort of medical professionals. These links, because of virtual care, can be virtual. Okay, there can be informal links between practices. There's a million different models that you can use. But you need to start considering different ways to deliver healthcare. The health market growth to increase access. We know in this country, and so again, also opened with this point, that in a practice now, if you believe the census, 62 million people, only about 9.5 or 9.2 million people of them are in the private sector. All the others still would love to come and see you. We've just got to make it affordable. Okay, and how can we do that? And Discovery Health has got now literally hundreds of thousands of people on insurance products, other products, not traditional medical aid. There's a whole range of other project insurance plans and other plans that are available to these patients, okay, to be able to access your care. And I'd ask you just to open your eyes and consider some of those programs. People-centered population health management and education. We're going to keep driving at that. Enhanced scope of practice for GPs. If you think about the value-based service model, they often talk about service lines. What are the service lines in your practice? Many GPs go to work, they see the next patient. Patient leaves, see the next patient. The way practices are being organized today is in service lines. Yes, there's family, but it might be a pediatric practice, a geriatric practice. There's doctors who have bought some investigator, like scanners and so on. They might be doing a service line on pathology investigations. There's a whole range of different things that you can do. You can do advanced illness care. You can actually stratify your practice to focus in on what makes sense for you. And that's what's going to enhance the scope of GP practice. We know who the patients are. Big data and data science can actually pick up these populations. Okay. How do we then fit the right patient to the practice that's got this particular interest? And hopefully it's fun for you, because you can actually do the things you like to do. Okay, which builds job satisfaction. Training and supports, again, spoken about that. We'll keep offering those. And clinical excellence has to be the bedrock of all of this. How do you understand if you've got clinical? Well, we'll keep it. You're about to get your GP profile, okay, which will give you a sense of how your practice actually fits against your colleagues on a risk-adjusted basis. So clinical excellence is absolute. That's got to be the bedrock of all we do. I'm going to quickly run through these processes, but before I do, I just want to give you an assurance that this is the Discovery Health 10-year strategy. Okay, in a nutshell. So we're going to move away from acute care to chronic care. Who drives the management of chronic care? Family doctors. Moving away from specialist-centric to primary care. I hope that gives you a sense of comfort. This is a headline strategy for us. Moving away from in-hospital to at-home and runs. I'm completely surprised that family doctors haven't started to admit patients into hospital at home. It's happening all around the world. Okay, patient can be admitted in their own home for a general ward, low acuity type of admission, with full monitoring, almost the monitoring the level of a high care admission. You can do it today with the support of 24/7 doctor support and a panel of physicians that will help you monitor those patients. You don't have to refer every patient to the physician. Okay, you can continue to manage them with the support. I'm going to please speak to our team outside. If you've never tried this, you've got patients who are going to love this, but you just have to try it. You've got to do something different. In-person to digital, I've spoken about, and fee-for-service to value-based care. That's where the world's going. These are the strategies that we're going to drive. For those of you who haven't tried it, we did have a problem with our Health ID digital platform. We rebuilt this thing from the bottom up. It hadn't been updated since I did the first presentation in 2012. It needed to be rebuilt. Okay, because of the new technologies that needed to be plugged on top. And I do apologize for those of you who are using it. We had a little bit of a hiatus where things didn't go well. and we were a bit ambitious in terms of what we thought we could achieve in the time that we had planned to do. So I'm pleased to say now that stability has returned. The platform's working really well. Okay, and I'm going to ask you, just give it, if you've stopped using it, just give it another bash. It's back on. Okay, and it's really working well. It supplies you with additional remuneration income, and importantly, that for that clinical excellence piece, all the information you need to manage your patients in a really excellent way. New thing built on top of now the new health ID improvements is new functionality for a patient to be able to speak to a doctor now. The first person that we're going to ask to be on this list, if your patient has chosen you as their primary care provider, okay, would be you. But that means that you've got to have an availability for digital consultation. Okay, because the patients are looking for people digitally. Okay, I'm just asking you to be there. Virtual physical therapy is a new mechanism. Okay, we can offer this virtually. You don't necessarily have to go to a therapist. It's much more cost effective. Okay, it's amazing. You can do this virtual tracking of movement, and in South Africa, it's going to be hybrid initially. They'll be in person, but you'll find people who couldn't afford physical therapy in the past can afford it now because it's a lower price point. Digital therapeutics, I'll just raise this and then I'll quickly just give the headings of the other programs, just so that you've got the headings, and then you can chat to our team outside if you want to know more about some of the other programs. But digital therapeutics, especially for depression, is available. It's internet cognitive behavioral therapy at a very low price point. If your patients either can't afford it or you can't get them in to see a psychologist, there's a digital process that they can go through. Clearly, if it's severe mental illness, if it's not necessarily appropriate, but the app won't let you go forward if the patient is severe, and they'll escalate care immediately if they're concerned. So this is evidence-based digital therapeutics, and it helps you with this pandemic of mental health that I spoke about. There's a whole range of other issues: health ID, primary care provider, as I say, virtual consultations, additional reimbursement for excellence through our value-based payment program. Okay, there we pay you for getting better outcomes for your population. We've paid out millions and millions of rand to family doctors who are getting great results, especially in diabetic care. Hospital at home, I'm going to beg you just to think about it, try it, think about it, please. Premier Plus mental health, I've spoken about. Cardiometabolic program. We're able to identify through big data patients at high risk of becoming diabetic. You can intervene. We've created benefits, not day-to-day, real benefits for these patients. You can help a patient avoid becoming a diabetic. Okay, the patients are highlighted to you. We think we've identified through big data those that are at risk. Okay, you've just got to be alive to it. And the other area, the final area, and please look out, we're going to be in collaboration with the Spinal Society, offering upskilling courses for the management of patients with back pain. It's a significant area of spend for Discovery Health. I'll just skip over that point. So really my final slide is things to think about in family medicine is redesign for operational efficiency and speed. You've got to do it differently. And there are ways to do it differently, but retaining quality, focus on wellness, early intervention, like pre-diabetic care, scaling, okay, and partnering with other medical professionals. That can be formal or informal, new business models, and diversification away. So thinking about service lines. Okay, what should I be doing in my practice? What are my areas of focus? How can I run my day a little bit differently? So with that, I'd love to be able to spend more time, but I know that you've got an excellent set of presenters. And again, just with great thanks to Sergey and Geraldine and the team for the invitation, and especially to all who came out today in person. I'm really grateful because, as I say, pretty tired of talking to people in bubbles on a screen. So thank you very much, everybody.